Hello, and thanks for joining me again for another video. In this video, we're going to talk about measuring your blood pressure. That is, getting a correct blood pressure measurement, whether you're doing it or someone else is taking a measurement on you. More specifically, we'll talk about how various factors, including the blood pressure cuff size, can affect blood pressure readings. The blood pressure cuff is the piece of fabric type material that's wrapped around your upper arm when your blood pressure is measured. An August 7th, 2023 recent study published in the Journal of the American Medical Association Internal Medicine looked at the effect of using a regular sized blood pressure cuff without adjusting the cuff size for each study participant's upper arm circumference. This study looked at 195 community-dwelling adults with varying arm circumferences. Using a regular-sized blood pressure cuff on people who should have been measured with a small-sized cuff resulted in a 3.6 millimeter of mercury lower systolic blood pressure reading. Systolic blood pressure is the upper number in your blood pressure readings. For example, if your blood pressure is 120/80, your systolic blood pressure number is 120. Back to the study. In contrast, among people who should have been measured with either a large or extra large blood pressure cuff, use of a regular blood pressure cuff gave respectively a 4.8 and a 19.5 millimeter of mercury higher systolic blood pressure reading. What does this mean? Well, what this means is that using a regular sized blood pressure cuff for everyone, regardless of how large or how small around their arm is, caused inaccurate blood pressure readings, most strikingly in people with larger arm sizes. Using the wrong size blood pressure cuff gives inaccurate blood pressure reading. For people who should have been measured with a small blood pressure cuff, their true blood pressure is likely a few points higher than what is actually measured. For people who should have been measured with a large or extra large cuff, that is those with large arms, their blood pressure measurement was higher than their actual blood pressure is. This difference is enough to possibly result in a diagnosis of hypertension, that is high blood pressure, when the person may not in fact really meet blood pressure criteria for hypertension if they have large arms and were measured with a blood pressure cuff that was too small. Let's now talk about other factors that can affect the accuracy of blood pressure readings. In general, regardless of whether an automated blood pressure machine is used or blood pressure is measured manually, meaning by listening with a stethoscope, there are multiple other factors to be aware of that can cause inaccurate or variable blood pressure readings. All of the following can result in inaccurate or varying blood pressure measurements. First, talking or trying to listen to someone. Next, a full urinary bladder. Next, measuring blood pressure through clothing. For example, taking a blood pressure reading on the arm without fully rolling sleeves up so that the blood pressure cuff is around the skin. Next, the clinical or the medical context of the situation. For example, measuring a higher blood pressure in someone who just fell down and is in a lot of pain does not necessarily indicate that they have high blood pressure. The pain and the anxiety associated with the situation can be causing temporary high blood pressure. Next, smoking around the time blood pressure is measured can elevate the pressure reading. Caffeine or other stimulant intake too close to the time blood pressure is measured can also increase the blood pressure. Mood, anxiety, or acute stress can affect the blood pressure reading. Sitting with the back or arm unsupported while taking the blood pressure reading can give an inaccurate reading. And finally, body position is important to the blood pressure reading. Depending on which other medical conditions or other situations at the time, whether a person is sitting, standing, or lying down can affect the blood pressure reading. Remember that generally speaking, the blood pressure that should be used to determine if someone has hypertension is the reading that's obtained in the standardized position. This is being seated with the buttocks on a seat, with the back supported on a backrest, for example, the back of a chair, and the arm supported where the blood pressure is being measured, and with both feet comfortably flat on the floor. Let's talk now about a few other key pointers when measuring blood pressure. Remember that hypertension is not diagnosed based on a single blood pressure reading. All the factors I've discussed in this video can interact in unpredictable ways to give inaccurate or temporarily elevated or temporarily depressed blood pressure readings. Hypertension is diagnosed and monitored by looking at averages of multiple readings and the trends in those readings. Ordinarily, blood pressure should also be compared both in a clinical setting, such as in the doctor's office, and also when measured at home under typical circumstances, because these two types of settings can also give very different types of blood pressure readings. For example, a patient might have high blood pressure readings in the doctor's office, but when they're at home or in another situation doing their normal daily routine, their blood pressure might be normal. This would suggest that the patient has what's known as white coat hypertension, meaning blood pressure that temporarily goes up in the doctor's office, but most of the time when the patient is doing their normal activities, other than being at the doctor's office, their blood pressure is okay. So that's a wrap on this video where we discussed different factors that can affect blood pressure readings and things you might want to be aware of to be sure that you get accurate and correct blood pressure readings. I hope you found this information helpful and interesting. As always, check with your own healthcare provider to determine which tests and treatments, if any, are appropriate for your specific circumstances. Thanks very much for watching and listening, and until the next video, remember, stay healthy.